The untold cost of drug and alcohol abuse and addiction in the United States is not financial. It comes in the form of broken families, destroyed careers, death due to negligence or accident, domestic violence and physical abuse, and child abuse. Drug abuse and addiction changes your brain chemistry. The longer you use your drug of choice, the more damage is done, and the harder it is to go back to normal during drug rehab. Mostly, people use psychoactive drugs because they expect some benefit, either getting pleasure or avoiding pain. However, using these drugs can cause harm in the short term and long term. A psychoactive drug or psychotropic substance is a chemical substance that acts primarily upon the central nervous system, where it alters brain function, resulting in temporary changes in perception, mood, consciousness, and behavior.
The drug we will be looking at today is MDMA, which is also commonly known as ecstasy or Molly, which is a common drug in raves and parties. Now, people consider ecstasy to be one of the safer psychoactive drugs, but I will describe to you today why that is not the case. First, with the physical effects. Ecstasy causes hyperthermia, which is the overheating of the body, which can lead to increase in heart rate and in blood pressure, which is very bad. Also, it can lead to bruxism, which is the grinding of teeth, which is why at raves people commonly wear pacifiers to prevent this. So you could say that ecstasy is the dentist's worst nightmare when it comes to psychoactive drugs. It can also lead to nausea, faintness, and blurred vision, which is why people don't exactly remember the day after whenever they have previously been on an ecstasy trip. It also is a very common drug to mix with others, so people mix it with ketamine, cocaine, marijuana, etc., 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 which can lead to, they can cross the side effects from each of the drugs, and also they can increase in severity of the already physical effects of ecstasy. Okay, and then moving on to the mental effects of ecstasy. It releases large amounts of serotonin, dopamine, and norepinephrine. That's the correct pronunciation. Also, and serotonin, it releases two hormones known as oxytocin and vasopressin, which are involved with emotional closeness and sexual arousal, which is why people take them to parties so that they can bond with new people, meet new strangers, and bond with them. But the sudden surge of serotonin all at once, it completely deprives the body of serotonin, which is why in days, even weeks after taking ecstasy, you get confused, you're depressed, your sleep rhythm is off, and it also leads to extreme anxiety. Now, moving on to social effects of ecstasy. Ecstasy increases energy, and it also creates a state of euphoria around you, it has been described by none better than Bone Thugs and Harmony in their song entitled Ecstasy, whenever Crazy Bone says, "I'm feeling so ziggity, 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 'cause I'm floating in ecstasy." That is a pretty strong state of euphoria, Crazy Bone. Also, ecstasy also affects emotional closeness, as I've said before, and empathy for other people, so they can connect easier with people, which is the reason why it's taken at parties very commonly.
It is an opiate synthesized by morphine. It is a highly addictive drug. There is a highly pure heroin, which is usually smoked or snorted. Also, impure heroin is injected into veins. Black tar is a sticky type of heroin mainly produced in Mexico and sold to the U.S. When heroin enters the brain, it is converted back into morphine, which binds molecules on cells known as opioid receptors, which control the receptors of pain, blood pressure, and respiration. Heroin overdoses can affect the amount of oxygen to the brain, a condition called hypoxia. It can have long or short-term effects. Users who inject heroin have a higher chance of getting HIV or HPC if sharing needles. After using heroin, it is reported to feel a rush. Symptoms of a rush include dry mouth, vomiting, warm flushing of skin, and severe itching. The more heroin one takes, the faster it enters the brain, causes a bigger rush. After the rush, people feel drowsy and breathing is slowed, which can cause life-threatening problems like coma or permanent brain damage. Repeated use of heroin can cause changes in physical structure. Heroin produces a tolerance and a physical dependence. A physical dependence is when the body adapts to the presence of a drug, causes withdrawal if reduced abruptly. Withdrawal symptoms are bone and muscle pain, insomnia, vomiting, cold flashes, and goosebumps.
Cocaine is the most dangerous drug known to man. Once a person begins taking the drug, it is proven almost impossible to become free of its grip physically and mentally. Next to methamphetamines, cocaine creates the greatest psychological dependence of any drug. It causes extremely heightened euphoria, intense depression, edginess, and craving for more of the drug. It makes people feel paranoid, angry, hostile, and anxious even when not high. Many people can experience increased heart rate, muscle spasms, and convulsions. Cocaine is a stimulant psychoactive drug that gives 15 to 30 minutes rush of euphoria, which immediately translates to depression, agitation, and lastly, addiction. It blocks dopamine reuptake pumps, thus evaluating levels of dopamine neurotransmitters in the brain synapses. However, dramatic and continuous stimulation of dopamine receptors immediately depletes the supply of serotonin, norepinephrine, and dopamine neurotransmitters in the brain. The main reason why the effects barely last an hour and why users usually crave for more. Although Sigmund Freud advocated the therapeutic use of cocaine as painkiller during eye surgery, the drug remains illegal in many countries. Cocaine is found to be very addictive, where 50% of those who receive treatment from addiction resume using the drug after only 6 months. Avid cocaine users can experience cocaine psychosis, which is a psychotic state of mind that results when a user has suffered an adverse brain response to the cocaine use. Like the majority of other mental health problems, drug abuse and addiction have no single cause. However, there are a number of biological, psychological, and social factors called risk factors that can increase a person's likelihood of developing a chemical abuse or chemical dependency disorder. While the specific physical and psychological effects of drug abuse and addiction tend to vary based on the particular substance involved, the general effects of abuse or addiction to any drug can be devastating psychologically. Intoxication with or withdrawal from a substance can cause everything from euphoria, as with ecstasy, to severe depression or suicidal thoughts with cocaine. In the terms of effects on the body, intoxication with a substance can cause physical effects that range from marked sleepiness and slowed breathing, as with intoxication with heroin or sedative hypnotic drugs, to the rapid heart rate of cocaine intoxication.